I just want to make a list, alright? A list of the important investigations and laboratory tests you might actually want to do to a patient. That's before the operation. So before an operation goes down, there are some one or two things that you want the patient to go to the lab and get for you, okay, for several reasons. So we'll just list all the possible ones you might need. Now, all the possible ones you might need, then you actually get to choose the one that is suiting your your situation. Okay, so preoperative lab tests, they identify underlying issues, of course. Okay, they identify underlying issues. Now, a complete blood count is often done to check for anemia, infection, or bleeding risk. Do you understand? Electrolyte levels such as sodium, potassium, chloride, and bicarbonate are accessed to ensure that fluid and electrolytes are actually balanced up. Okay. Renal function tests, like the check for your urea, check for your creatinine. You evaluate kidney health with that one. Okay. Especially in patients with kidney issues, heart issues, endocrine issues. Okay. Sorry, that was electrolyte. Sorry, I'm not using the cursor, so let me use my mark now. So what again? We said that renal function test was urea and creatinine, right? Liver function test, if the patient has liver disease or alcohol use or anyone that is taking any hepatotoxic medication. Blood glucose test, they do that for people that you are suspected that probably they have diabetes. Okay. Then cardiopulmonary imaging test, all those chest x-rays for people above 60 generally, and people who smoke. Okay, so you get that done for them. Then pulmonary function tests are used for patients with chronic respiratory disease or those undergoing thoracic surgeries. Special investigations is depending on the patient and procedure, so additional tests may be required if the patient is pregnant, pregnancy test, blood grouping and cross-matching, if they need transfusion, of course. You screen them for HIV and hepatitis B and C. Thyroid function test can be ordered if thyroid disease is suspected.